Most people over 60 have no idea that magnesium, the supplement they think is harmless, can either save their heart, calm their nerves, help them sleep, protect their bones, balance their blood sugar, and support over 600 biochemical reactions in the body. Or it can trigger total chaos inside the bloodstream in under 20 minutes if taken at the wrong time, in the wrong form, or in the wrong health condition. In fact, a 2024 European clinical review found that four very specific warning signs mean your body cannot process magnesium safely, and when adults ignore these signs, magnesium can push potassium levels off balance, weaken the heart's electrical rhythm, overload failing kidneys, or even cause severe drops in blood pressure that leave seniors dizzy, confused, and at risk of falling. What makes this scarier is that pharmacies and supplement companies never mention these risks because magnesium is now a billion-dollar yearly business and the fastest-growing supplement among adults over 55, who are targeted with ads claiming it fixes everything from headaches to anxiety to high blood pressure. But here is the twist almost nobody talks about. While four signs mean you should never take magnesium, there are also five opposite signs that mean your body is desperately begging for it every single day. These are the hidden deficiency signals doctors find in blood work, sleep studies, heart rhythm scans, nerve conduction tests, and muscle enzyme results. In this video, we will reveal the four warning signs that mean you should never take magnesium and the five powerful signs that show you must take it daily, and stick around because sign number 2 is the most dangerous, the most scientifically proven, and the one that shocked researchers the moment the data came out. Reference list is available in the description below to support everything discussed here with real science and clinical studies. Before we dive in, here's a quick question for you. How old are you? Tell us below because we're reading and replying to every comment. Now let's get started and uncover the hidden signs your body has been trying to warn you about, starting with sign number 4. That mean you should never take magnesium again, and you won't believe what comes next. Number 4. Severe kidney disease. Your kidneys are like your body's filtration system, working around the clock to clean your blood and remove waste products through your urine. When you have severe kidney disease, specifically chronic kidney disease stage 4 or 5, these vital organs can't properly filter out excess minerals anymore, and this is where magnesium becomes dangerous rather than helpful. The medical community defines severe kidney disease as having less than 30% kidney function remaining, which means your kidneys are struggling to do even basic filtering tasks. When someone with severely compromised kidneys takes magnesium supplements, the mineral builds up in their bloodstream because it can't be properly eliminated through urine like it normally would be. This accumulation leads to a condition called hypermagnesemia, where magnesium levels become toxically high in your blood. The symptoms start subtly with muscle weakness and fatigue, but as levels continue rising, you might experience dangerous drops in blood pressure, irregular heartbeats, and in extreme cases, your heart could actually stop beating. What makes this particularly treacherous is that many kidney disease patients already take multiple medications, and adding magnesium to the mix can interfere with how these life-saving drugs work. If you have kidney problems, your doctor needs to monitor your magnesium levels through regular blood tests before even considering supplementation. The safe approach for people with kidney disease is getting magnesium only from food sources in controlled amounts, as your body naturally regulates absorption from food much better than from supplements. Foods like spinach, almonds, and whole grains provide magnesium in forms that are less likely to accumulate dangerously. Plus, they come with other nutrients that help your body process minerals more safely. The key indicator that your kidneys might not handle magnesium well is if your doctor has told you that your GFR, glomerular filtration rate, is below 30, or if you're on dialysis or approaching the need for it. But here's something crucial. The next warning sign affects millions who don't even know they have it. Number 3. Myasthenia gravis. Myasthenia gravis sounds complicated, but it's essentially a condition where your immune system attacks the communication channels between your nerves and muscles, making it progressively harder for your brain to tell your muscles what to do. This autoimmune disorder affects about 20 out of every 100,000 people, and if you have it, magnesium supplements could dangerously amplify your muscle weakness. The reason lies in how magnesium naturally works in your body. It acts as a muscle relaxant by blocking calcium from entering muscle cells, which is normally beneficial for preventing cramps and promoting relaxation. However, when you already have a condition that weakens the signals between nerves and muscles, adding more muscle-relaxing magnesium to the equation is like trying to drive a car with failing brakes and then pouring oil on them. People with myasthenia gravis often experience drooping eyelids, double vision, difficulty swallowing, and extreme fatigue that gets worse with activity, and magnesium can make every single one of these symptoms significantly worse. The neuromuscular blocking effect of magnesium is so powerful that anesthesiologists actually use magnesium medications to enhance muscle relaxation during surgery, which shows just how potent its muscle weakening properties can be. Research from the Journal of Neurology found that myasthenia gravis patients who took magnesium supplements experienced respiratory muscle weakness severe enough to require mechanical ventilation in some cases. The terrifying part is that this weakness can affect your diaphragm, the main muscle responsible for breathing, potentially leading to respiratory failure. If you have myasthenia gravis or any neuromuscular junction disorder, you should only get magnesium from dietary sources under strict medical supervision, and even then, your intake should be carefully monitored. Your neurologist needs to know about every supplement you're considering because what seems like a harmless mineral could trigger a medical emergency. Speaking of medical emergencies, the next warning sign involves a common heart condition that makes magnesium surprisingly dangerous. Before we continue, lock in your spot by hitting like and subscribe. The health truth you need is right after this. Number 2. Heart block. Heart block isn't about clogged arteries like many people assume. It's actually an electrical problem where the signals that control your heartbeat get delayed or completely blocked as they travel through your heart's conduction system. Your heart has its own electrical wiring that coordinates each heartbeat, starting from the top chambers and traveling down to the bottom chambers in a perfectly timed sequence that keeps blood flowing efficiently. When you have heart block, especially second or third degree heart block, these electrical signals move too slowly or stop entirely at certain points, causing your heart to beat irregularly or too slowly. Magnesium acts as a natural calcium channel blocker, which means it slows down electrical conduction in your heart even further, potentially turning a manageable heart rhythm problem into a life-threatening situation. The danger becomes exponentially worse because magnesium's heart-slowing effects are dose-dependent, meaning the more you take, the slower your heart's electrical system becomes. Studies from the American Heart Association show that patients with heart block who take magnesium supplements have a significantly increased risk of complete heart stoppage, requiring emergency pacemaker insertion. The symptoms of worsening heart block include severe fatigue, dizziness, fainting spells, shortness of breath, and chest pain, all of which can be mistakenly attributed to other conditions. If you've ever been told you have a prolonged PR interval, bundle branch block, or any degree of AV block on an ECG, magnesium supplements could push your heart's electrical system past its breaking point. Emergency room doctors are trained to look for magnesium toxicity in patients presenting with severe bradycardia, slow heart rate, because it's a reversible cause that requires immediate treatment with calcium gluconate to counteract the magnesium's effects. Your cardiologist needs to carefully evaluate your heart's electrical system before you even consider magnesium supplementation. And if you have a pacemaker, the interaction between magnesium and your device's settings requires special attention. Now, the final warning sign might surprise you because it involves medications millions of people take every single day. Number 1. Certain medication interactions. The medicine cabinet in your bathroom might hold the key to whether magnesium supplements are safe or dangerous for you, because certain common medications create potentially lethal interactions with magnesium that most people never see coming. Antibiotics are the first major concern, particularly tetracyclines, and fluoroquinolones like ciprofloxacin, because magnesium binds to these medications in your digestive system, creating complexes that your body can't absorb properly. Blood pressure medications present another serious concern, especially ACE inhibitors and potassium-sparing diuretics, because combining them with magnesium can cause dangerous accumulations of both magnesium and potassium in your blood. This mineral buildup affects your heart's rhythm and can lead to cardiac arrest, which is why emergency rooms always check medication lists when patients come in with dangerous arrhythmias. Digoxin, a heart medication used for atrial fibrillation and heart failure, becomes significantly more toxic when combined with magnesium supplements because magnesium affects how your kidneys eliminate this drug. The interaction is so serious that the FDA requires warning labels about it, yet many patients taking digoxin don't realize that their over-the-counter magnesium supplement could trigger digoxin toxicity. Muscle relaxants and medications for myasthenia gravis become dangerously potent when combined with magnesium, potentially causing respiratory failure as your breathing muscles become too relaxed to function properly. Diabetes medications like sulfonylureas can have their blood sugar-lowering effects amplified by magnesium, potentially causing dangerous hypoglycemia that could lead to seizures or coma. Even common antacids containing aluminum or calcium can interact with magnesium supplements, creating mineral imbalances that affect everything from your bones to your brain function. The timing of when you take these medications relative to magnesium matters enormously. Most need at least a 2 to 4 hour separation, but some interactions persist regardless of timing. What's particularly insidious is that these interactions might not cause immediate obvious symptoms, instead slowly building up to dangerous levels over weeks or months of combined use. Now that we've covered when you absolutely shouldn't take magnesium, let's explore the 5 critical signs that mean you desperately need it. Number 5. Severe muscle cramps and twitches. Those painful Charlie horses that jolt you awake at 3 a.m. aren't just annoying, they're your muscles literally screaming for magnesium, and ignoring this warning could lead to permanent muscle damage and heart problems. Magnesium is essential for muscle contraction and relaxation because it regulates calcium flow in and out of muscle cells, acting like a gatekeeper that prevents muscles from staying contracted when they should relax. When magnesium levels drop too low, calcium floods into muscle cells uncontrolled, causing them to contract violently and refuse to let go, creating those agonizing cramps that can last for minutes. These twitches happen because without enough magnesium, your motor neurons become hyperexcitable, firing off random signals that make your muscles jump and twitch uncontrollably. Athletes are particularly vulnerable because they lose massive amounts of magnesium through sweat. A single intense workout can deplete up to 20% of your body's magnesium stores. The best form of magnesium for muscle cramps is magnesium glycinate because it's highly absorbable and less likely to cause digestive upset compared to cheaper forms like magnesium oxide. You should take 420 milligrams daily for men or 320 milligrams for women, ideally split into 2 doses with meals to maximize absorption and minimize any stomach issues. Taking it with vitamin D enhances absorption even more because these nutrients work synergistically to support muscle function. The timing matters too. Taking magnesium before bed not only prevents nighttime cramps but also improves sleep quality since magnesium activates your parasympathetic nervous system. For immediate relief during a cramp, you can use transdermal magnesium oil or lotion directly on the affected muscle, which bypasses digestion and delivers magnesium straight where it's needed. Foods rich in magnesium like pumpkin seeds, dark chocolate, and spinach should become daily staples, but supplementation is usually necessary to correct a deficiency quickly enough to stop the cramps. Your muscles will tell you when levels are improving. The cramps become less frequent and less severe, and that restless, jumpy feeling in your legs at night finally goes away. But muscle problems are just one piece of the puzzle. The next sign affects your entire day from morning to night. Number 4. Chronic fatigue and low energy. That bone-crushing exhaustion that doesn't improve with rest isn't just being tired, it's your cells literally unable to produce energy because they're missing the magnesium needed to create ATP, your body's energy currency. Every single cell in your body uses ATP, adenosine triphosphate, as fuel, and here's the critical part that most people don't understand. ATP must be bound to magnesium to become biologically active. Without magnesium, you can have all the ATP in the world, but your cells can't use it, like having a car full of gas but no key to start the engine. Your mitochondria, the powerhouses of your cells, require magnesium for over 300 enzymatic reactions involved in energy production. And when magnesium runs low, these reactions slow to a crawl. The fatigue from magnesium deficiency often comes with brain fog, difficulty concentrating, and feeling like you're moving through molasses because your brain uses 20% of your body's energy despite being only 2% of your body weight. Magnesium malate is particularly effective for fighting fatigue because malic acid itself plays a role in energy production, creating a synergistic effect that boosts cellular energy more than magnesium alone. The recommended dose for chronic fatigue is typically higher than the standard RDA. Many functional medicine practitioners suggest 600-800 milligrams daily, divided into multiple doses throughout the day. Morning supplementation can provide an energy boost without the crash associated with caffeine, while evening doses support recovery and restorative sleep that actually leaves you feeling refreshed. You should start feeling improvements within 2 to 3 weeks, beginning with better morning energy and gradually extending throughout the day as your cellular magnesium stores rebuild. Combining magnesium with B-complex vitamins amplifies the energy-boosting effects because B vitamins are cofactors in energy metabolism that work hand in hand with magnesium. The transformation can be dramatic. People report going from barely making it through the day to having energy for exercise and hobbies they'd abandoned due to exhaustion. Signs that your energy is improving include waking up actually feeling rested, having stable energy throughout the day without crashes, and your mental clarity returning to normal. The difference between normal tiredness and magnesium deficiency fatigue becomes obvious once you correct it. Suddenly, you remember what it feels like to have real energy again. Yet, even as your energy returns, there's another sign that might be keeping you up at night. Number 3. Insomnia and poor sleep quality. Lying awake at 2 a.m. with your mind racing isn't just frustrating. It's a classic sign that your brain lacks the magnesium needed to activate sleep mechanisms and calm your nervous system for rest. Magnesium acts as nature's relaxation mineral by binding to GABA receptors in your brain, the same receptors targeted by sleep medications and anti-anxiety drugs, but without the addiction risk or morning grogginess. When magnesium levels drop, your sympathetic nervous system stays stuck in fight or flight mode, pumping out stress hormones like cortisol and adrenaline that make sleep impossible, even when you're exhausted. The research is compelling. A landmark study in the Journal of Research in Medical Sciences showed that magnesium supplementation increased sleep time by an average of 36 minutes and improved sleep efficiency by 15% in people with insomnia. But it's not just about falling asleep. Magnesium is crucial for reaching deep, restorative sleep stages where your body repairs tissue, consolidates memories, and produces growth hormone. Without adequate magnesium, you might sleep for 8 hours but wake up feeling like you barely slept at all because you never reached those deeper sleep stages your body desperately needs. Your brain's pineal gland needs magnesium to produce melatonin, your natural sleep hormone, which explains why magnesium deficiency often causes that tired but wired feeling where you're exhausted but can't shut your brain off. The optimal protocol is taking 200 to 400 milligrams of magnesium glycinate, or 3 and 8, 30 to 60 minutes before bed, as this timing allows levels to peak right when you're trying to fall asleep. Creating a magnesium-rich bedtime routine amplifies the effects. Try taking a warm bath with Epsom salts, magnesium sulfate, while sipping chamomile tea, as the warmth increases absorption through your skin. Many people notice improvements within the first week, starting with falling asleep faster and waking up less during the night, then gradually experiencing deeper, more refreshing sleep. You'll know it's working when you start waking up naturally before your alarm, feeling actually refreshed instead of groggy, and when that 3 p.m. energy crash disappears because you're finally getting quality sleep. Dreams often become more vivid and memorable as you spend more time in REM sleep, which is a positive sign that your sleep architecture is normalizing. While better sleep transforms your days, the next sign might be affecting your cardiovascular system right now. Number 2. High blood pressure. Your blood pressure creeping up year after year isn't just aging. It's often your blood vessels crying out for magnesium, the mineral that naturally relaxes artery walls and could save you from a lifetime of medication. Magnesium works like a natural calcium channel blocker, preventing excessive calcium from entering the smooth muscle cells in your artery walls, which keeps them relaxed and flexible instead of tight and constricted. When magnesium runs low, your blood vessels constrict like a garden hose being squeezed, forcing your heart to pump harder to push blood through narrowed passages, driving up your blood pressure readings. The mechanism goes deeper than just vessel relaxation. Magnesium also helps your kidneys eliminate excess sodium, reduces inflammation in blood vessel walls, and improves endothelial function, which is your artery's ability to dilate and contract properly. People with hypertension often have significantly lower intracellular magnesium levels even when blood tests appear normal, because standard blood tests only measure the 1% of magnesium floating in your blood, not the 99% inside your cells where it actually works. Magnesium taurate is particularly effective for blood pressure because taurine itself supports cardiovascular health, creating a synergistic effect that outperforms other forms for hypertension. The therapeutic dose for blood pressure is typically 400–600 milligrams daily, but it's crucial to monitor your readings because combining magnesium with blood pressure medications might lower pressure too much initially. You should take readings at the same time each day, preferably in the morning before coffee, to track improvements accurately. Most people see changes within 4 to 8 weeks of consistent supplementation. The beauty of magnesium for blood pressure is that it addresses the root cause rather than just managing symptoms, potentially allowing some people to reduce or eliminate blood pressure medications under medical supervision. Combining magnesium with potassium-rich foods amplifies the blood pressure benefits because these minerals work together to regulate fluid balance and blood vessel function. Your doctor might be surprised at your next checkup when your readings have improved without adding new medications, but make sure to mention your magnesium supplementation so they can adjust your treatment plan accordingly. This cardiovascular protection extends beyond just blood pressure to something even more serious. Number 1. Irregular heartbeat and palpitations. Those fluttering, skipping sensations in your chest that make you feel like your heart is doing somersaults aren't just anxiety. They're often your heart's electrical system misfiring due to magnesium deficiency, and ignoring them could lead to dangerous arrhythmias. Your heart relies on a delicate balance of electrolytes to maintain its rhythm, with magnesium acting as the stabilizer that prevents electrical signals from becoming chaotic and triggering irregular beats. When magnesium levels drop, your heart becomes electrically unstable, like a circuit board with a loose connection that causes random shorts and misfires, creating those uncomfortable palpitations that might last seconds or minutes. The Harvard Medical School study I mentioned earlier found that people with the lowest magnesium levels had an 88% higher risk of developing atrial fibrillation, the most common serious arrhythmia that increases stroke risk 5-fold. Emergency rooms actually give intravenous magnesium as a first-line treatment for certain arrhythmias because it works within minutes to stabilize the heart's electrical activity, proving just how powerful this mineral is for rhythm control. Magnesium works by regulating calcium and potassium channels in heart muscle cells, preventing the electrical chaos that causes everything from harmless PVCs, premature ventricular contractions, to life-threatening ventricular tachycardia. The palpitations from magnesium deficiency often worsen with caffeine, stress, or exercise because these factors further deplete magnesium and increase your heart's electrical instability. For heart rhythm issues, magnesium orotate or glycinate taken consistently at 400-500 milligrams daily provides the best results, as these forms have high bioavailability and are gentle on the stomach. The timing is crucial. Splitting doses between morning and evening maintains steady levels throughout the day, preventing the fluctuations that can trigger palpitations. Many people report that the anxiety about their heart symptoms disappears once the palpitations stop, revealing that much of their anxiety was actually caused by the physical sensations rather than psychological factors. The improvement can be so dramatic that people who were considering cardiac ablation procedures or daily antiarrhythmic medications find they no longer need these interventions. Your heart rhythm stabilizing is one of the most powerful signs that your magnesium levels are finally optimal. Remember, your body is constantly sending signals about what it needs, and these signs are impossible to ignore once you know what to look for. Whether you need to avoid magnesium due to medical conditions or desperately need supplementation to fix deficiency symptoms, the key is listening to your body and working with healthcare providers who understand these nuances. Taking action on these warning signs today could be the difference between struggling with mysterious symptoms for years or finally finding the relief you've been searching for. If this information opened your eyes to something you didn't know about magnesium, hit that subscribe button so you don't miss more health revelations that could change your life. Thanks for watching.